Dan, good morning and nice job out there. Yeah, I think parents have pretty much made up their minds for the most part, at least the ones I've talked to. But the ones who do have questions really are curious about the rollout when it comes to this vaccine. Yes, there were questions about safety, about efficacy. Does it work? How can I get it? So I do want to bring in Dr. Phil Huang. He's the director for Dallas County Health and Human Services, who's joining us this morning. Thanks so much for waking up early and being with us. And Dr. Huang, Suzanne sort of touched on it, but for parents who are waking up today and really last night, once the CDC director signed off on this, they go, okay, now where do I go to get my kid vaccinated? I think that is the most common question I'm getting. For kids in Dallas County, what's the process?
Sure. There's going to be widespread availability. We're starting sort of a slow rollout initially, make sure everyone gets trained with the new vials and dosages. So it'll be the first day we'll be offering just in very small quantities to get everyone up to speed and the processes in place. By the next couple of days, that will increase in terms of capacity. Again, I know the pharmacies and grocery stores are also doing that. I think Ellis Davis is planning on starting to offer it next Monday, but there will be very quick ramp up of the availability of this. We're also working with some of the school districts to make some of those similar, what you were hearing about earlier, pop-up clinics at some of the school sites, probably after school, so parents can be there, but working out the details on some of those.
And so, if I'm hearing correctly, Dr. Huang, it's that you're going to have to wait, parents, be a little patient. It might not happen today. It might have to wait until next week or perhaps the week after or the week after. And so is there any advice that you have in terms of should parents register? Is this going to require some wait time? I think a lot of people were thinking, well, could I get my kid vaccinated before Christmas or before some sort of travel for this holiday season?
Sure. No, I think it's going to be a pretty quick ramp up. We also have our site at Eastfield College. I know they're getting all prepared. Again, some limited availability today, but we're going to get that ramped up in the next couple of days to much higher volumes. But I know we're going to be offering appointment times that people can make the appointments online, and some of the pharmacies. Grocery stores would need to check with them on how they're setting up those appointments.
And just quickly, in terms of the training that you mentioned, people who have children with comorbidities or any other underlying health condition, maybe it's a kid who had COVID 2 weeks ago and the parents wondering, is it too soon to get my child this vaccine right now? Is that part of what you guys cover in the training before administration?
Absolutely, that's part of it. Making sure, again, if there are any unique aspects regarding, mixing the doses, drawing up the shots, things like that, and as well as all of the other information about this vaccine. But in terms of some of the questions, like if you've had COVID, the answers to those are pretty similar to what we've been saying with some of the other vaccines. You shouldn't come in if you have active disease. If you've recovered, and actually after you've had it, you could wait up to 90 days, but there's no contraindication to getting it earlier. But you don't want to come in until you've gone through the appropriate isolation time.
Okay, I think that's important to note for parents. Dr. Phil Huang, thank you so much for your time today. By the way, if you do have additional questions, you can text the word vaccine to the number there on your screen, 214-977-6028.